Imagine being in the prime of your life and then experiencing an illness or injury that threatens to take away your sight. Today we're going to hear about an amazing breakthrough in treatments with adult stem cells that's giving sight to the blind. Stay with us. Dr. Edward Holland is the Director of Cornea Services at the Cincinnati Eye Institute. In his time there, he attracted worldwide referrals for medical and surgical corneal problems. His cutting-edge work involving adult stem cell corneal transplants is helping patients who've been suffering from blindness and corneal diseases for years. Dr. Holland, you have patients coming from virtually all over the country and various parts of the world. What draws them to your practice here?
Well, we've been working on procedures to rehabilitate severely injured eyes, specifically eyes that have lost the specialized skin over the front of the eye. And these can occur from chemical injuries such as severe acid or alkali injuries to the eye. And then there's some genetic conditions where patients inherit a gene that causes the skin of their cornea, the surface of the eye, to fail. And so we need to do a specialized ocular surface stem cell transplant to rehabilitate these eyes. And if I could show you what specialized tissue we're talking about. So as a review, the clear window in the front of the eye is called the cornea, and the white part of the eye surrounding that is called the sclera. And the cornea is different because it is transparent and has a very specialized skin that grows over it. And the conditions that we manage are conditions in which this specialized skin gets injured or damaged. The skin starts from an adult stem cell at the edge of the cornea called a limbal stem cell. And we grow new skin cells over the cornea, and then the older cells slough off and get replaced by new adult skin cells. And the condition such as a severe chemical injury that splashes on the eye not only damages the cornea, but more seriously, it damages the adult stem cell population surrounding the cornea. So we have worked on procedures in taking adult stem cells, transplanting them around the cornea, allowing that skin layer to work. If we did a standard corneal transplant in which we would take the diseased cornea off and then from an eye bank take a human corneal donor, which we do all the time, that procedure will fail if the patient can't grow new specialized skin. So we have to correct the skin surface problem first and then address the cornea issue second. And that's where the ocular surface stem cell procedures have really allowed us to fix some of these patients that we couldn't help, say, 10 years ago.
If you could briefly describe in layman's terms what adult stem cells are and what the process is of harvesting them and using them.
Adult stem cells are cells that have already gone somewhere in the patient's own body and are functioning as a site-specific cell. And they're still stem cells, though, because they continue to give rise to daughter cells. So if we think about that tissue in the eye, if we don't have a cell that gives off new skin cells, we will stop supplying skin cells to the cornea. The cornea then without skin becomes opacified and the vision fails. So the adult stem cells that reside at the edge of the cornea continue to give off daughter cells for the rest of the patient's life. And we are supplying that layer of adult stem cells for the ocular surface.
Dr. David Prentice is founding member of Do No Harm, the Coalition of Americans for Research Ethics. He has studied the success of adult stem cells in treating cancer, cardiac, and even Parkinson's disease. Meanwhile, the use of embryonic stem cells has met with failure.
Most people haven't heard much about the success of adult stem cells. We can document with peer-reviewed published science now where patients, not lab rats, but patients have been helped for at least 72 different diseases and injuries.
So where do you get the adult stem cells that you use?
Primarily, we have three choices. If the patient has an injury of one eye, we can actually go to their normal fellow eye and take some of the cells from that eye and transplant that, called an autograft. And that would be fortunate, because if it's the patient's own cells, they can't reject that tissue. But unfortunately, the majority of patients have injuries to both eyes. That's the patients we typically get. And we then have two choices. We can use a human corneal donor, somebody who's died and donated their eyes to the eye bank. The second option is to take a relative, a parent or a child who has a pretty good tissue typing match, and use cells from one eye of that donor, living donor, to transplant to the ocular surface of the diseased eye. So, and then sometimes actually we use both. We use a living donor and a cadaver donor to get more cells in the worst cases.
Now describe for me what type of vision these patients have before and after the procedure.
Most of the patients have what we call light perception vision. The scarring is so bad that they can't count their fingers in front of their eye. They can see basically light and dark, and that's kind of the vision that the most severe injuries have. Many of the patients have had multiple surgeries and yet still have poor vision. So if we can take one of these patients and give them some vision back, it's a tremendous thing for them.
Now what kind of results, Dr. Holland, have you had with this type of transplantation of adult stem cells?
It really depends on the severity of the injury. There's a lot of other factors that go into it. By and large, if we take all our patients that have had ocular stem cell transplantation, about 75% of the patients have a successful outcome, which if you think back, say 10 to 15 years ago, we had a 0% chance of helping these patients with standard corneal transplant. So now we have a procedure that about 75% of the time can rehabilitate the surface, and then we can go on to the other transplants that we need to rehabilitate the vision. So I think we've had some very good success.
When we return, we'll meet Jeff Long, a patient whose life is changed due to the success of ocular stem cell transplants.
Whether you're a student needing answers, a parent needing help, or a concerned citizen wanting to make a difference, Life Issues Institute has the resources you need to put your values into action. Life Issues Institute is an international educational organization committed to protecting innocent human life. Life Issues Institute knows what it takes. That's why millions throughout the world turn here for help. Life Issues Institute has authored more pro-life publications than any other entity in the world, and its materials are printed in over 30 languages. Radio broadcasts, newsletters, and a website filled to the brim with the answers you're looking for are just a click away. Go to facinglife.tv and click on the link to Life Issues Institute to find out more about how you can change the heart of a nation.
What would it be like to live day to day knowing you could eventually lose your eyesight? How would it affect your family? For Jeff Long, a high school math teacher, clear vision was never a reality. As a young boy, Jeff's vision was poor and slowly began deteriorating as he got older. After years of being misdiagnosed, Jeff and his wife Linda flew from their hometown of Hayesville, Kansas to Cincinnati. There, Dr. Holland was able to correctly diagnose Jeff's rare condition. After having adult stem cell transplant surgery in 2004, Jeff can now see clearly. Tell me a little bit about your condition, Jeff. What it was like when things first started to make their appearance.
I started noticing like my perception, like if I was playing softball, the ball would come at me and I would kind of, I came a little faster than what it used to, and like my driving, things would come up on me a little quicker. I knew I had a problem there, so went to the doctor, and I used to wear my vision when I was real little. I was always bad, and they put me in hard contacts when I got older. And then when I got to the point where I was having problems, they would scrape it off, and then it would grow back over again, the scarring.
Jeff has a condition, it's called aniridia, and it's not a great name, but it was named decades ago because the patients are born without an iris, so aniridia. Now Jeff is a variant of that because actually Jeff has a iris present. It's not a normal iris, but he has an iris. So that name was applied, but patients with this condition have multiple problems with the eye. They have a corneal stem cell problem. They often have glaucoma. They have cataract. They have retinal problems. But what happens to the cornea and aniridia is when the patient's born with aniridia, they are producing normal skin cells from their limbal area, and those cells divide and the cornea looks good. Usually in the early teens, we start seeing changes. Those stem cells start to die out, and they don't produce normal cells, and secondarily they get scar tissue growing in. And for decades, these patients would get corneal transplants. They'd get a transplant, the transplant would look good, and then 3 or 4 months later, all of a sudden these scar tissue cells would grow in and the transplant would fail. And again, we didn't know why until the whole story of stem cells and could aniridia be a stem cell problem, and now we know it definitely is.
What was your eyesight like before you began treatment?
If I was sitting 20 feet from the TV, I couldn't read anything on the TV at all.
You could see the TV?
I could see the TV, the images. I mean, I could be able to see it, but I couldn't read any of the words or anything like that.
Linda, how was this for you as his spouse to see him go through this?
It was hard. It's very hard. It was hard when his vision was getting so much worse because he was having trouble driving. I don't like driving. I had to drive us everywhere. It was hard because we went to the doctor over and over again. I mean, sometimes 3 times a week or 4 times a week we would see Dr. Gangadar, our doctor in Wichita, trying to figure all this out. And he had heard Dr. Holland speak at a conference, and that's what got the whole thing started. But all the monitoring and the doctor's appointments, and it's hard.
Did you think that your husband was going to go blind?
I mean, I knew it was a possibility, but he was already at 2200, 2400. He was having a lot of trouble seeing things anyway. So it was pretty much like he was blind because we had to do a lot for him. I mean, he could see more than just someone who's totally blind, but yeah, that was always a concern, definitely.
So you went through a long trial and error period before you were diagnosed, correct?
A lot of people don't seem to know about this. Nobody in Wichita knew about this. Our doctor, Dr. Gangadar, is fantastic, very knowledgeable guy, and he heard Dr. Holland speak at a conference and said this is what it is. After 38 years of people saying it's this, so we'll treat it like this, and that didn't work, and this didn't work, and people were baffled. Some of the best doctors in Wichita were baffled that they couldn't figure out what it was.
Had this condition not been identified and treated, where would you be today?
I probably would be able to see. Would be blind. Wouldn't be able to function.
Now that Jeff is on the road to recovery, the next concern for the Longs is their 2 daughters, Whitney and Emily. Both have inherited Jeff's condition. The family is optimistic the girls will be able to face it and receive the same successful treatment in the future. Tell me a little bit about your 2 daughters, where they're at in life and how they've reacted to their situation.
Our oldest is 18. She'll be starting college in the fall, and she played sports in high school. She played softball, and she has the perception issues, some of that already now. With the softball coming at her, she was slower at that. Her hitting was affected by it. She can still read, she can still drive. She has contacts that help her vision. She's corrected to about 20/40 now, which is probably about as good as it's going to get. Our kids, they've never corrected to 20/20, which is one of the characteristics of aniridia. But our younger one, the 14-year-old, she doesn't have a lot of issues with it yet. She just went to the eye doctor in our hometown, and she doesn't see well enough right now to pass a driver's test, and she's 14, so she'll want to do that soon. So they know the limitations they have. They've seen their dad. They know what we have. They've talked to Dr. Gangadar in Wichita. They talked to Dr. Holland here, and they know what they face.
When we return, we'll learn what's on the horizon for adult stem cell transplants.
Thank you for inviting us into your home. Each week we feature real people who deal with real life issues head on. Some of their experiences are uplifting, while others will break your heart. But in the end, the message is clear. Those who follow biblical principles on the issues of life are blessed. Become a partner with us in providing a positive, life-affirming message to help change the way the next generation values innocent human life. Please consider a generous gift to help offset the costs of producing this important quality programming. You can donate on our secure website at facinglife.tv or by calling the phone number on your screen during normal business hours. Together, we can make a real difference for life.
The stem cells used in cornea transplants are adult stem cells. Dr. Holland discusses how adult stem cells can differ from embryonic and the advantages they bring. How do adult stem cells differ from embryonic stem cells?
Well, embryonic stem cells obviously come from an embryo, and people are interested in those cells because they're pluripotential cells like the bone marrow cell. And proponents of using embryonic cells talk about the use of these cells because they can transform into lots of different tissue, and that's where some of the research interest is. We're fortunate in ophthalmology that we have a good access to adult stem cells, and we don't need embryonic cells. I, at this point, don't see any advantage of us taking embryonic cells because the cells that we need are healthy cells readily available from a living relative or a cadaver donor, and they're the exact cells we need to rehabilitate the eye.
The problem, or one of the problems with embryonic stem cells, is just that. Can they be made safe? Can they be effective at actually treating disease? The theory has been that because these cells potentially could form any types of tissue, you could turn them into nerves to treat stroke, into heart tissue to treat heart attack, treat any sort of tissue damage in the body. But to do that, you have to be able to get them to make the cell type that is needed to integrate effectively in the tissue and work with the other cells, and do it in a controlled manner. So far, embryonic stem cells haven't been able to do that. They have a disturbing tendency to form tumors when put into the mice, and also to make not just the cell type you might want, to make any other type of cell as well. So it's a jumbled mess, in fact, for trying to treat and repair damage and disease.
With 75% of ocular stem cell patients experiencing successful outcomes, Dr. Holland contemplates the future of adult stem cell research. He's optimistic about making strides to further the use and success of these cells. In today's science and use of adult stem cells, they're available from the patient's own body and other areas too, right?
Yes. There are some work in Japan to take care of the same patients we're taking care of. They're harvesting adult stem cells from the lining of the mouth. The lining of the mouth, as well as other places in the body, these specialists are looking at tissue called mucous membrane, and they can take some adult stem cells from the lining of the mouth, grow the cells in the laboratory to get sheets of healthy cells, and then transplant those cells to the surface of the eye, and those cells actually then transform into corneal skin cells. And that's been one of the more novel ways of looking at other sources of cells. It's a different approach. The cells aren't quite the same as human corneal cells that we transplant. So the question is, are those cells going to work as well as truly corneal skin cells? And I guess the test of time will answer that question.
Are you optimistic that as you're able to advance medicine more, the science of this adult stem cell research using the patient's own stem cells, that you can get over that rejection problem entirely and help this 25%?
Yes, I think the future is to look at adult stem cells from the patient. And as I talked about the work in Japan using the cells in the lining of the mouth, and then there's some more recent work on using bone marrow cells. And why would we try to take a cell from the bone marrow and use it for the eye? Well, cells in the bone marrow are pluripotential cells, if you will. They can transform into any tissue in the body. You can take the cell out and put it in the laboratory, and if you put it in an environment that promotes bone growth, the cell will turn into a bone cell. If it can turn into a skin cell, it can turn into a cornea skin cell, if you will. So if we could have a situation where we have a laboratory that can grow these cells into corneal skin and then transplant that skin, we would never see rejection because it's the patient's own cells, and you will not reject your own tissue.
Coming up, we'll see how Dr. Holland and his team help patients face life head on.
Whether you're a student needing answers, a parent needing help, or a concerned citizen wanting to make a difference, Life Issues Institute has the resources you need to put your values into action. Life Issues Institute is an international educational organization committed to protecting innocent human life. Life Issues Institute knows what it takes. That's why millions throughout the world turn here for help. Life Issues Institute has authored more pro-life publications than any other entity in the world, and its materials are printed in over 30 languages. Radio broadcasts, newsletters, and a website filled to the brim with the answers you're looking for are just a click away. Go to facinglife.tv and click on the link to Life Issues Institute to find out more about how you can change the heart of a nation.
Dr. Holland's work is known worldwide, and he's often called on to lecture and author articles. What motivates him each day is the love of helping patients get the results they need. I suppose it would be accurate to say that you're perhaps one of the leading experts in this particular field of medicine in the country. I know that you've received many awards over the years for your work, your research, including being on the list of the best doctors in America. Now, I'm curious to know